My name is Ron Lewis. I'm an internal medicine physician here with the internal medicine group at Lake Charles Memorial Hospital. I've been an internist for approximately 20 years, and diabetes is a major component of my practice, being an internist. Everyone know what an internist is? Internal medicine? Okay. Don't? Yes? All right. Internal medicine is the medicine for adults. Okay, we don't deliver babies and see children. One specialty of ours does, but not usually. We take care of adults. I'm not an endocrinologist. Anybody know what an endocrinologist is? Well, diabetes is one of their specialists. The problem is there's just so few endocrinologists to go around. Okay? So the rest of us have to take care of it. Now, to be an endocrinologist, you have to be an internist first. Okay? So, that's what I'm here talking about. I trained at the University of Mississippi Medical Center, for all you LSU fans, so I'm an Ole Miss grad. Go Rebels, okay? All right. But my goal here today is, we got some slides, we got some data. My goal is to talk to you like I do my patients in my office, okay? Because diabetes has become, not so much here recently, but in the past, a mystical kind of something that we treated and we see every 3 months, okay? But it's a real disease. It's associated with increasing age and increasing weight, and it is treatable. And there are a plethora of drugs and different ways to treat this, but there are insurance companies, there are co-pays, there are first tier, second tier, third tier. All right? So my job here today is to treat you like my patient. And at the very beginning, we talk about diabetes, and then we put you in control of your disease. My job is to give you the tools. I can't come to your house and stick your finger and adjust your insulin every day. Okay? We teach y'all to do that. And by my experience, we probably don't give y'all enough credit. In my practice, my patients take care of their diabetes because we coach them and we encourage them to do it. And it is very doable. All right? And I'm going to show you how to do that to a certain degree. Nothing's perfect. All right? Now, I will tell you this. This talk is made for people who are not doctors, who are not nurses. Well, maybe nurses, but not doctors. Okay? To keep it simple. I'm from Arkansas originally. So I'm a keep it simple, stupid kind of guy. Okay? Now, simple does not mean bad. It just means more consistency. All right? Hook it up. Now, first thing I'd like to do is I'd like to thank Lauren, and I thought I got a last name already. She's with Lake Charles Memorial Hospital Marketing Division, and Philip Longyon is the technical guy. Okay? And I'd like to thank Memorial Hospital for helping us put this on. And for my family and everybody on the web, hi. All right, we are streaming live on the web. Now, one place you can see these slides that I'm fixing to show you, anybody can look at. And that's diabetes.org. I know a lot of y'all on the internet, right? It's a great website, okay? So you can go there. Now, first of all, how many type 2 diabetics we got? Any type 1s? There's a 1. Okay, type 1 diabetes and type 2 diabetes are two different types of diseases. Type 1, you don't make enough insulin. Type 2, you're insulin resistant. Type 1's pretty rare. Okay, although we talk about it a lot, it's not that common. So, for this talk, most of my talk is going to be on type 2. A good portion of it, the effects of diabetes on the body and things, are pertinent to type 1. But we treat type 1 a little differently than we do type 2.
Is type 1 like juvenile diabetes?
Yes, ma'am. We don't say that anymore.
I didn't know that.
And then there's insulin-dependent diabetes. I hate those terms. Type 1 is usually diagnosed in people less than 35 years of age, but not always. And they just don't make insulin because their pancreas, the cells in their pancreas that make insulin are not working. Okay? And we think that's an autoimmune disease, but we're not real sure yet. Okay? So type 2 diabetes are the ones associated with weight gain, age, and some other factors, okay? All right. Now, so why do we even talk about diabetes? What's the big deal? Okay? Well, the big deal is it's increasing, okay? Part of that is because our weight's increasing, and we'll get to that in a minute, and our age is increasing. And another thing is we're better at treating it, so more people are living with it. Now, also the incidence of it is occurring at younger ages, okay? Some of y'all may not be interested in that, but what I'm trying to say, it affects us all. It affects our taxes, affects Medicare, everything, okay? So what we need to do is all do our part to do better, okay? I'm going to go through, and y'all have got your slides in front of you. If you want to follow along, fine. My suggestion, just sit back and watch. Okay. Diabetes affects 25.8 million people of all ages. That's roughly 10% of our population. Okay? All right. So 8.3%. Now, diabetes is the #1 cause of amputations, blindness, and going on the dialysis machine. The #1 cause. Okay? All right. So if we could at least arrest that or do better, we could lower some of that. Let's see. It is the, it's the 7th leading cause of death. Okay? So if you have diabetes and you have any other problems, hypertension, heart disease, any other medical problem, it's worse. And your risk of dying is 2 times that of somebody who does not have diabetes. Okay? All right. Now, there are some genetic things that make some differences. Whites are a little less likely, Hispanics are a little bit more likely, Native Americans are more likely, African Americans. Basically, we're all in this together. Okay? So, you just have to be, if you're African American or Mexican or Native American or Puerto Rican, you have to be a little more careful. The weight gain is tremendously important. You will become, if you get obese and you're one of those cultures, you will become diabetic, period. Okay? If you're African American and white, you got less of a chance. Okay. Let's look, just so I can strike this message at home. County level estimates of diagnosed diabetes, percentage of adults greater than 20 years. 2008. That's 5 years ago. Look where we are. We're the darkest color on the map. Okay? That's Southwest Louisiana. All right? Great place if you treat diabetes, like me. Okay? But my point is, it's our culture, guys. It's just our culture. All right? So, we're #1. Okay? All right. Now, I don't mean to be too flippant, but these are the real facts. All right? And then we're going to talk about how we fix this. Okay? All right. And you can say, Louisiana leads the way, along with Arkansas, Louisiana, and Mississippi. Okay. Let's talk about treatment of diabetes. How many people just take an oral medication? See there? Matches up with the chart, right? Okay. How many people take insulin only? Not many. 1, okay? And then oral and insulin, okay? All right. Now, you see the biggest thing there, okay? Now, we would love to have y'all here. No medication. Okay? That is doable. Okay? for this reason, and I'm going to draw on my thing here. Now just bear with me. Can y'all see these circles? Everybody see them? Little circle, big circle. Little fat cell, big fat cell. Okay. When we go through puberty, all of our fat cells we're ever going to have are there. So we don't grow more fat, we grow bigger fat. Got that? That's why liposuction works. Or else you just grow it all back again. So, now the fat we're talking about is not the kind hanging right here over the belt. It's the kind that's around your organs, visceral fat. Okay? Now, so everybody understand what we're talking about? Okay, fat. All right, little fat cell. Now, I apologize to my doctor friends, but this works for my patients. Little fat cell. They have receptors on there that sit there and wait for Mr. Insulin. Insulin is a hormone. Does anybody know what hormone means? Messenger. And the message it carries is glucose. All right, sugar. Can y'all see that? All right, when that cell gets bigger, you don't grow more insulin receptors, so they get spread farther and farther apart. And what happens is it takes more and more and more insulin to get that same amount of glucose in the cell. And your body's good at that. So anybody who's type 2 diabetic makes more insulin than I do. Okay? You understand that? For this reason right here. All right, let me show you how that works. This is normal insulin, say 15 units a day, okay? Normally I make 15 to 20 units a day. Insulin, anybody taking more than that? Okay, all right. So what happens is, I get up in the morning, I eat, I secrete insulin, I go to bed, and it goes back down. It does like that. Okay? People with type 2 diabetes are like this. Making more insulin because of that receptor problem. You understand that? It takes more to work. Now your body's only so good. It will fail at that. Okay? So, how do we get around this problem? Go right back to that. Lose weight. Okay, and it doesn't have to be a big, horrendous drop. 15 pounds. And you might go from medication to diet-controlled diabetes, or at least something that doesn't require insulin-type drugs. Okay? But that's doable. There are 2 organs in your body that don't utilize insulin to work. Anybody know what they are? She's got one. What else? Your brain and your skeletal muscle. And God gave you them so you could run from the animals. Okay? Because if you had to wait on that messenger to get that, you'd be eaten. All right? So you can use them. So, exercise. Okay? Exercise and diet. Y'all heard these before, right? And I'll tell you, most everybody in here looks like they're doing it. Okay? But I want to tell you, it works. It works. And it don't cost a thing. You don't have to get a pre-cert from your insurance company. Your doctor don't have to write 5 letters to get your drug. Okay? All right. Enough about that. So, any questions at this point? Anybody got a question? All right.
So if you lose weight and exercise, you don't have diabetes?
Now, if I lose weight and exercise, does that mean I'm better looking? Probably, okay? But your diabetes will be better. You will be healthier. Remember what I said, the 3 biggest things, dialysis, amputations, and blindness, okay? All right? And any disease you have is worsened, okay? Exercise is good for everything. I understand, okay? I'm not going to preach that, but you need to know the facts. There's nothing better. The biggest bang for buck is exercise. Diet is second. Okay? Exercise works better than diet and exercise alone. Okay? So, did that answer your question?
I'm pre-diabetic, so.
There you go. So in your case, probably.
Say again.
Probably you won't be. Okay? All right. Now, there are some special cases when people, due to genetics and things, they're real thin, they're type 2 diabetic. Y'all are kind of a special case. It does happen. But I'm not going to tell you not to exercise.
Oh, no.
Okay? All right. Okay. So. All right, let's see here. Okay, remember what I said about type 2 diabetes being a disease of the mature, okay? See there? Age 70 plus. All right? I can tell you if you're 70 or close to that age and you get overweight, you will be diabetic. Okay? It'll happen. All right? Let's see. All right. I'm going to skip some of this. All right. Don't worry about that. Y'all know it costs a lot to treat and everything. Okay, let's talk about management of your diabetes. Anybody got any questions? Y'all all doing it great. Working great. All right. How many times are you supposed to check your sugars a day, realistically? Twice. And you're supposed to do it when? Morning and night. Close. Fasting. Right? Before you eat. Does everybody do that? Okay. Now another little tidbit. If you're on Medicare and insurance companies are doing this now, write them down. They're requiring that to be in your medical record to get your diabetes supplies. Okay? All right. So, check your sugars fasting. Now, do we know what our hemoglobin A1C is? What is it?
Was 3 months ago, 6.5.
Okay, so what is the hemoglobin A1C? This mysterious God particle. What is it? Okay, when your red blood cells are made, the amount of glucose put in that red blood cell is based on your sugar level at that time. And you make red blood cells every day, 24 hours a day, every second of the day. Okay? A red blood cell lasts about 3 months. So with pretty good accuracy, we can take a sample of your blood, look at the hemoglobin A1C level in that blood sample, and know about what your blood sugar has been for the past 3 months. Okay? Now, does anybody know how to calculate their blood sugar level from their hemoglobin A1C? The formula is about this long. The easy way is your hemoglobin A1C, let's say it's 8, which is not a bad number. So what average sugar is that associated with? Does anybody know? 8 minus 2 times 30. That's easy, huh? You got that? Y'all need to write that one down. That's not in anything I'm fixing to show you. Now, that's not precise, but it works. So if your hemoglobin A1C is 7, and 7's a big number we're going to need to remember, okay? 7's that magic number. If your hemoglobin A1C is 7, 7 minus 2 is what? 5 times 30 is what? 150. Remember those numbers, 7 and 150. Okay? Now again, remember, this is my practice, me talking to you as my patient. I don't pretend to speak for any other doctor. Okay? All right? All right. Now, so in my practice, I want your hemoglobin A1C 7 or a little less. So that means I want your sugars, what? 150 or a little less. So those fasting glucoses in the morning, what do I want them? 150 or a little less. Okay? Okay, just remember that. Now, the hemoglobin A1C is the way we can effectively look at, with some accuracy, the effect of treating diabetes on disease states. Okay? For example, if the hemoglobin A1C, until it gets down to 9, you're just off the scale. Now what is 9? minus 2. That's 7 times 30, 210. Not that high. Okay, average. Okay, that's 24-hour average. Okay, so once you get down to 9 and you go to 7, you reduce 95% of all those bad things associated with diabetes. 95%. Some of this starting to make sense now? You understand? Okay? So how many people, don't tell me, but you know, if your hemoglobin A1C is above 9, your doctor's not happy, right? Okay? If he's 8, he's saying you're doing better, but let's try to do a little better. That's why. We get you to 7, statistically, we improve the outcome in the country. Now, if you go from 7 to 6, what's 6? 6 minus 2, 4 times 30, 120. Not that much difference between 150 and 120, is there? Okay? Really hard to do sometimes. Okay? But what do we gain? You gain an extra 2% in reduction in those symptoms. Okay, that might, when you talk about 30 million people, 2% is a lot. But when it comes down to you trying to do that on a day in, day out basis, it's hard to do. And people get tired of failing. Okay? Mr. Here, is that right? That man's got a hemoglobin A1C of 6. He counts every carb, he reads every label, he's not on any medicine yet, but he's worried that his numbers are changing. That's fantastic. I would not have the energy to do what he does. It's fantastic he does that. Personally, I wouldn't want his hemoglobin A1C any lower. I actually said, take a break. Okay? All right? There's too much, sometimes we worry too much about this stuff. So if you're 9 or above, you worry. You're 9 or below, you're getting better. You're 7, you're very good. Now, if you're hanging out at 7 and you're like Mr. Boutte and you got it all together, we'll push you a little lower. So why don't we want you as low as we can get you? You might know? Remember those medications we use to treat diabetes? Most of them are oral. Guess what? Once they're in your system, they're there. And if we drive you too low, you're too low for a while. So what we found was trying to push people in the normal range, they died from hypoglycemia. Okay? So, 7 looks good from where I sit as a doctor. Now, if you're good enough and you're smart and you're there, I'll take 6.5. I'll take 6. Now, some of my type 1s on a pump, insulin pump, I got them at 5 point something, okay? But that's a whole different situation. All right? And some of my really obese people who are using tons of insulin, I'll put them on a pump. Now, if you're taking, 200 units of Lantus a day, that's too much insulin. That's just too much. And to be honest with you, and I don't see anybody here like this, but we used to see it all the time. Anybody can out-eat anything I give them. Okay? Now, is everyone familiar with low blood sugar? Anybody ever had it? Okay, all right. So what are the symptoms? Nausea, headache, break out into sweat, get a feeling of impending doom like you're going to die, get confused. Okay, at that point, we don't check our sugar, okay? All right, don't be so compulsive, I got to check my sugar. You eat. You get some sugar in you, okay? I'll tell a lot of my patients, just carry a Coke in the car, regular Coke in the car in the glove box or something, because anybody can drink a hot Coke, okay? You don't necessarily have to have orange juice with sugar in it, just anything with glucose in it, okay? And if that starts happening to you regularly, you need to sit back and think about, okay? So if your morning glucose is starting to be 120 or less, you better start watching for hypoglycemia, because if you're at that level and you get out and mow the yard, and use all them muscles, sucks up all that glucose, you start, okay? All right?
What's that number you said? What are those?
120. 150 is good. for me.
And
That's a hemoglobin A1C of 7. Okay?
I'm usually in the 80s.
You got it? That makes sense? Okay. Got any more questions, ask me after the talk. So 150 to 120. You start getting 120, you run a chance of getting hypoglycemia. Okay? All right.
we'll talk after.
Yeah. Now, anybody know where, somebody asked me, how do we check our sugars? Okay, and the short answer is get any blood you can. I wouldn't stick my finger on a daily basis for nothing. Okay, I just wouldn't do it. Hurts. There's so many nerve endings there. Do your palm, do your forearm, do this. It doesn't matter. Okay? Because if you're in the hospital sick and you're in a cast and you got all that stuff coming out, we just get blood wherever we can. All right? So don't get too fastidious about all this, okay? It's not that precise. All right. Let me stop and think just a second. Okay. Anything else about the hemoglobin A1C?
Yes, I'm sorry, I have to ask another question.
Shoot.
The hemoglobin A1C is told to me when I go get my blood work done.
Yes, ma'am.
But there's no way I can know what my,
Actually, you can buy it over the counter.
because I do the little morning stick of my feet.
Well, what I'm telling you, you can work that equation backwards. If you're 150 every morning, what's your average hemoglobin A1C?
How do I know what I am in the morning if I have to go to the hospital to get blood work? I don't understand.
Don't you stick your finger every morning?
Yes, and it's in the 80s.
Okay. So
Is that the same?
your
thing?
husband knows math, right?
Is that the same thing?
Same thing. Work the hemoglobin A1C backwards.
Well, is 80 too low?
Nah.
Okay.
My doctor said 80 to 120.
That's if you're diabetic and taking medicine.
That's normal.
Yeah.
So
Okay.
when I stick my finger and it shows 145.
You taking medicine?
Yep. Is it pretty good?
That's a good number. If you go to 80 and you're on diabetes medicine, I guarantee you're going to go too low. You'll be over-treated. Does that make sense?
Well, right before today it was 118.
And believe me, it's a whole lot easier to get sugar down than to get it up when you're too low. Okay.
118.
Yes, ma'am.
What about 24?
24 what?
If the checking the blood sugar is 24, when first responders come out,
You better eat. You're confused. If you're below 25, you're starting to lose consciousness. As people get sleepy, they start falling asleep. Okay, now if that starts happening, you need what's called a glucagon pen on hand. Okay? You just squirt it together and shoot it in the muscle and it'll raise your sugar. Okay? But I don't recommend everybody have that. If somebody's brittle, like quote brittle, which means their sugars variate quite a bit, I'd usually recommend. We have them in the clinic. Somebody walks in. All right. So that makes sense? Okay. All right. Forgot what I was going to say. That's okay.
I heard that somebody said that they were taking just the insulin shot once a week. Is that a fact?
No, it's not insulin. It's one of the newer medications.
Oh, what is it?
Victoza.
They need to put me on there.
Yeah, your insurance won't pay for it.
Why?
I don't know. All right, this one's it. Okay. Yes.
There's some medications that can affect your blood sugar.
Yes, there are. Steroids. Anybody taking prednisone? Okay. Well, you know, it'll raise your sugars. Sometimes they're necessary. Yeah. Depends on what you're taking them for. You have to be careful. Really careful. And I say that because I give my diabetics steroids all the time. But I monitor them, okay? They go to another doctor who gives them steroids, who's not monitoring their diabetes, becomes a problem. especially the back injections. Any of y'all got those? The steroid injection in your back? Those will really drive your sugars high. So, they happen. Okay, now, does anybody know how diabetes affects your body? This is really important. I think it's really important people understand what's the big deal about your sugar being high? Why do we care? Well, we know it causes those diseases, okay, makes other diseases worse. How does it do that? Does anybody know? Okay, when your glucose is high, and it stays like that for a while, it's toxic to your very small blood vessels. I mean the ones that supply your fingers, the nerves of your fingers and your feet, your retinas, and your kidneys. Okay? That makes sense, right? We talked about amputations, blindness, and dialysis. So, that's what we're trying to prevent. And over time, it will get you. If you're a type 2 diabetic and you're pretty good controlled, by the time you're 100, you're going to have side effects from it. Okay? Doesn't matter. But any disease that you get or any manifestation you get of diabetes is better with lower sugar. Okay? And that's how diabetes affects those very small blood vessels. And once they're gone, they're gone. They don't come back. Now, there are some in transition. Now, a lot of y'all might know if you have peripheral neuropathy. Who else? Anybody got that? Don't be bashful. It's worse when your sugars are up, right? Okay, so if you get your sugars down, the peripheral neuropathy gets better. Now, there are other causes of peripheral neuropathy, not just diabetes, okay? And that needs to be differentiated, okay? But now, the big problem with peripheral neuropathy is what? Does everybody know what we're talking about? Peripheral neuropathy? Pain and numbness of your feet and your hands. Okay? It also affects your balance. There you go. Okay. Peripheral neuropathy, when those nerves are damaged. The reason I can do this is because I don't have to think about it. My feet know, my brain and my spinal cord knows where my foot is. Okay? When you have peripheral neuropathy, that's lost. And most people tell you have bad peripheral neuropathy, they can't walk in the dark. And give them a flashlight and try to walk on it, and they really can't do it. They have to actually consciously see their feet through their vision. Okay? So their brain will know where their feet are because they can't tell. So peripheral neuropathy is bad about getting sores on the feet and wounds. It's also bad about falling. Okay? So my advice is if you got type 2 diabetes, start making your home safe. Get the rugs up, look around, have not lights on. If you go outside, turn the lights on, don't get a flashlight and start running around because you will not feel the ground. You won't know where your feet are and you'll just run right out of them. Okay? Does that make sense? Okay. Number 2 is get your eye exams every year. And go to your optometrist or your ophthalmologist and tell them you're diabetic. And they will look at your retina and they can tell if you've had any damage to your retinas, the vessels and behind your eye. Now, once you've gotten those in the behind your eye, it's a pretty good indication your kidneys are involved. Okay? All right, so if those are good, the beans are good. Okay? The feet and the peripheral neuropathy is a little different, but if you keep your diabetes under control, it's better. Now, be very careful on your feet. Does anybody know if anybody stepped on a nail or a tack that was diabetic and didn't know they had it in there? I got a man in the hospital right now. I don't know how long that nail was in there. You know? He started having something dripping out of his foot, which was pus, but he didn't feel it. Okay? Now, there's one other thing that comes along with diabetes. It's the big D. Anybody know what that is? Denial. Okay? All right? Now, I'm not fussing or I'm not pointing fingers, but we just don't want to deal with it. Okay? But if you don't, it's like paying insurance. Okay? If you don't have it and you don't do it, you will really wish you had when you need it. Okay? And I'm not saying you have to worry about this and do it every day, but look at your feet. Okay? If you got those gnarly nails, get them taken care of. Okay? People come to my office all the time, and I tell them I have this talk. They come in, I haven't seen them in a few months, and they got that nasty old nails on their feet. Okay? See if you can get them taken off. Most people will not touch you nowadays if you're diabetic. You have to get a reference from your doctor, but get those things taken care of. Okay? If you got the bad foot fungus, get it taken care of. All right? All right. Now,
why do some diabetics are cold most of the time, their hand and feet?
not all diabetics are, but some can be because of the circulation problem in those small. Okay. Now, a lot of people suffer from those conditions anyway.
Yeah.
So if they're diabetic, they tend to be worse. Okay. All right. You still have, just because you're diabetic doesn't mean you don't have the same normal stuff. Hormonal problems, blood pressure problems. Okay. All right. Now, one more thing about diabetes that's particularly important. Syndrome X. Anybody heard of that? Metabolic syndrome. Okay. Diabetes, high triglycerides, cholesterol, waist wider than your hips. Okay. All right. All some of that's genetic, but it's all can be treated through treating your diabetes. If you treat your diabetes, the chances are a lot of those things will get better. All right. So every diabetic should be checked for hypertension and probably should be on one of the medications for hypertension. Look at them. You are considered to have coronary artery disease. Have your cholesterol treated. Now I know that's controversial. Nobody wants to take a medicine unless they have to. My advice is take it if you can tolerate it. I got my daddy on them. Had my mom on them. Because the risk of not taking those medications is stroke and heart attack. Everybody understands a heart attack. Most of the time people can get over those, get them fixed. You can't fix a stroke. Once that damage is done, it's done. Now, depends on your point of view. Some people are fortunate if they have a bad stroke, they pass. A lot of people don't. And they're debilitated for the rest of their lives. Okay? And it's just tough on a family. So do everything you can to prevent those things. All right? Yeah. Oh, don't expect your hemoglobin A1C to change, but like every 3 months. Now, there are extenuating circumstances. If I take you and really keep your sugars controlled for 2 months, it'll change. But more than every 3 months is too much. Just wasting your time. All right?
It's once a year.
No.
Should it be more, less?
Uncle Sam says I'm supposed to do it every 4 months. Check it, okay?
But we gotta go to the doctor to get him to.
I understand. It's a big pain in the posterior. I understand that. Okay? But, I'll take a couple in a row and then, or let my patients come in, just get them, not see me, I'll call them. Okay? All right, it's 3 minutes. Everybody's getting tired. You're not supposed to talk more than 45 minutes at a time. I want to thank you all for coming. I want to thank Memorial Hospital for putting this on. And again, if there are any questions, y'all want to talk to me afterwards, feel free to talk to me after this. Thank you all very much.